standing hip range of motion. This technique is also referred to as controlled articular rotations, or CARS for short. Mainly, CARS is used as an assessment tool for joint health and limitations in the joint range of motion, although this can also be used for maintenance. Matt will begin by facing a wall with his arm pressed up against it. Usually this is done by holding a fist out in front, although pressing against the wall will have the same effects. By having the arm out in front and performing this against the wall, it will help to isolate the hip movement. He will begin by driving his knee straight up as high as he can. Then the leg is moved away from the midline, and he will begin to slowly internally rotate the hip. This is done by attempting to turn the heel up to the ceiling. This is followed by driving the leg back as far as possible. This can then be repeated a couple of times, ensuring that there is no pain or movement other than the hip joint itself. Throughout the movement, he will be focusing on keeping the spine and supporting legs straight, ensuring that there is no compensation other than within the hip itself. Eventually, the directions will be reversed, beginning by taking the leg back as far as possible and then driving the knee up to the ceiling for that external rotation. The leg is then brought towards the midline and up as far as possible for the hip. A common misconception with the CARS movement is that it will increase range of motion. Remember that the main focus of CARS is to maintain and evaluate the range of motion of joints. The way that CARS assesses joint health is through the hip rotation. If you have issues rotating your hip internally or externally, this could be a sign that this joint is not healthy, and can be used to indicate that pails and rails may not be the best fit for you, as it could result in an injury.